My one friend, she was prescribed painkillers, and she told me it would help my back. And I tried them. And at that time, I did not realize the gravity of how much trouble it would put me in of taking the painkillers. And I quickly became addicted to them.
I was married, and about 2011, my son, who has autism, knocked out my front 2 teeth. He headbutted me. He did that several times, and I went to the dentist, and I needed some work done. I also had an abscess, and it was so painful. He prescribed me some painkillers, and I kept thinking, well, if I'm only going to do a little piece of one, it's really not that much. But I was doing that over, the past 8 years, till finally I lost my marriage.
Right around the time I turned 21, I kind of fell in the run with the wrong crowd. I made some dumb decisions, pretty much. Got caught up in drugs, and did that for about a year and a half. I got pregnant with my first child. I overdosed.
You're just tired and you're beat from this constant cycle of continuing to damage everything in your life. It's either this or death. Like, you have to stop it somehow.
The last day I took my last piece of pill, it was on the bottom of my floor mat, and it was wet and muddy and disgusting, and I ate it off the floor. I licked it off the floor. Because I would have ate it out of someone's mouth. I mean, when you're addicted like that, you don't care how, as long as you're getting it, you don't care how you get it. And that's when I knew. I mean, I really had hit rock bottom, and I felt dirty, I felt ugly, I was ashamed, and that was my first day of being honest with myself and everyone else, that I was a drug addict.
We work with patients on changing their attitude toward substance abuse.
It's a very comprehensive program. Taking medications for opioid addiction is like taking medications for any other chronic illnesses. There are multiple medications that can be used. One of them is buprenorphine, which is a partial agonist, and it blocks the opioid receptors, and that's why it prevents cravings. During our appointment, based on the history, we gauge what medication is needed, and then on that particular day, they also meet with case management. We set up appointments with behavioral health services and then prescribe the medication.
Here we do it differently. We make the patient a part of the team, the doctor, myself, we all come to the same conclusion for whatever is best for the patient.
We believe in treating the whole person at Sadler Health Center, and the outcomes are proven to be successful. It treats the root causes of the drug addiction that were there in the first place that maybe led them down that path. And doing that assists the patient in moving on and rebuilding relationships with family and friends, and being able to go, back out to be productive in society, have a job. It really helps them to move on and refocus from addiction to recovery.
Very compassionate people, very caring. They really wanted you to succeed, and they really took an interest in making sure that you were going to meetings, making sure that you were taking your medication properly, and making sure that you were going to be ready for the next step.
I wanted them to look at me like as a human being, and they did. They never judged, never criticized, always made me feel good.
What makes this program work better than some other programs is that we are here to help them. They know that. We show them compassion, we respect. We are not judging. We're here for them. Any person, regardless of age, sex, race, if they're unemployed, homeless, if they have insurance, they have no insurance. We are the place that will take them, I would say, in the community with open arms.
Addiction is a disease of the brain. It is not a moral failing. And that is what we have to educate the community. There is this huge stigma that is associated with addiction.
I don't care who you are, you can't do it alone. And the Sadler program, they're there to support you and lift you up and guide you to where you need to be today.
Medical assisted treatment is a way that we can teach the brain how to live without narcotics. I can see people that come to me often from the depths of despair, and a year, 18 months, maybe 2 years later, they now get their kids back, they get their families back, they're able to hold a job, they're able to be productive in society, and they're able to feel good about themselves and able to live without narcotics.
I don't know where I would be today if it wasn't for the Sadler program. It made me want to wake up every day. It made me feel better about myself. And it gave me another chance. And I'm so happy.
I was on the path of destruction. My family had written me off. Nobody wanted to be friends with me. And, I got all of that stuff back because of the program. I can live a normal life, and every day is a new day.
It's given me hope that I can actually be a productive member of society, that I can actually work towards my goals and have a future and be somebody that I can like and that I can enjoy. So it gives me a lot of hope.
Hope springs eternal, and all you have to do is call and we're available for you.